Here is another case of an osteogenic sarcoma, but in this case it is the proximal tibia rather than the distal femur. The vast majority of them occur either in the distal femur or proximal tibia of late teenagers. And once again, you could see in this x-ray that the surface of the proximal tibia is not uniform at all, but it is very irregular and it is destroyed, and you could see very dense tissue which has the same density of bone growing out extensively into the soft tissues. And here it is medially, and here it is posteriorly. Notice that the distal femur does not appear to be involved, and perhaps even the cartilage of the proximal tibia is not involved either. Here's another x-ray in which you could see once again not only the fact that there is destruction of this proximal tibia, but you could see separate metastatic lesions away from the primary area as well. And here is the gross specimen. Often in pathology, the x-ray is regarded as the gross specimen for bone disorders and bone tumors. In this case, we also have the advantage of the actual gross bone specimen that we just saw. Notice how the articular cartilage is spared, and the distal cortex is also spared, but the tumor, which arises in the distal shaft, has completely gone through the growth plate. If there was still a growth plate, all you see is complete replacement by this irregular tumor destroying cortex. And we saw in the x-rays going out into the soft tissue even as separate nodules, but we don't see it here. Let's take a look at the microscopic view. And once again, you can see, perhaps peripherally, that there might be some remnant of destroyed cortical bone. On the other hand, there might not be much. And even though there might not be much of what you would call normal or residual bone here, when you look at the entire tumor itself, consisting of these small cells, notice how they are making this primitive osteoid. Osteoid is defined as bone before it is mineralized. And very often, osteoid, even a normal osteoid, may look something like this. Notice that there is not much by way of osteocyte dwelling within these spicules yet, but it has an irregular, proteinaceous, perhaps not terribly calcified matrix, so classical of osteoid. The vast majority of the cells around this primitive bone in osteoid are tumor cells. Occasionally, you may see inflammatory cells, of course, blood vessels, but the majority, 90% of the cells in this field, are tumor cells. And all of these irregular reddish stellate lesions is what the tumor is trying to produce, bone. Thank you very much.